Hey guys, today I'm going to show you how to put on some AE stockings, also known as anti-embolism stockings, also known as anti-embolism stockings. These are stockings that allow some compression to the legs, allow for good blood flow, and it also prevents thrombosis. Stockings are specific to the patient. They are certain sizes. So first thing you're going to do is you're going to have measurements done. I don't know if you're going to do them or someone else might do them. So what you do is you measure from the ankle all the way up to the groin. Then you're going to measure the width of the thigh, and you're going to measure the width of the calf. You want to do each leg because sometimes the legs can be different sizes. Once you get your measurements, you're going to look at the back of the manufacturer's package. It'll tell you which size to get. Sometimes they're knee length or thigh length, so make sure you're specific and you make sure you get the right ones. So what you're going to do is when you open your package, your stockings kind of look like this. There's one side that's smaller and usually colored, and that's where the toes go. And the outside is smooth, whereas the inside's a little rough, so you know if it's inside out or not. First thing you're going to do is you're going to stick your hand in here, find the heel and put it in the palm of your hand and close your fist. And then you're going to turn it inside out. So you have it inside out. Before you put the stocking on, you want to make sure the patient's legs are dry. There's no moisture. If there is, you can always use some talcum powder or any powder and get that off. It's up to your hospital what you guys will be using. So you start, make sure the heel's on the back. You put it over the patient's toes, like so, and you pull up the ankle all the way to the back. So you pull up the back of the thing to the ankle, So for this purpose, on him, the stockings are a little bit smaller, but you would push it back, and then you would go this way and open it up and just kind of pull it up. You're going to have to work with it, kind of tug and like pull it up. It can take some time. After some practice, it probably will be easier. But on this side, once you have the stocking completely on, you can see there are no kinks, there's no wrinkles. It has to be completely smooth. You want to make sure you get all the wrinkles and kinks out. And the toes do not actually come out of the little hole. The hole either goes on top or bottom of the toes. You don't want your toes to be coming out of it. After you get them on, you'll know how long to keep them on. It's going to be based on your order. These are patient specific. We usually don't reuse them. They're usually just washed, hand washed, and then let to dry, and they have another pair they're using in the time while the other one dries. If you forget how to apply these, usually the stockings come with directions. It tells you exactly how to use it and if you need any tips or hints on it. Secondly, I'm going to talk about sequential compression devices, also known as SCDs. These are other devices that are help with blood flow. They're mainly used in people who are immobile. It helps the blood flow since they cannot move their legs or move around. The blood flow, the device helps compress and make the blood flow easier. I don't have one here with me, so I actually have a picture on my computer that I'm going to show you and show you how it works. Okay, so this is the device. It prevents DVTs and peripheral edema, like I said, in immobile patients. It's for long periods of time when immobile patients, they get pooling of blood in their calves, so you want to get the blood flowing. So what usually it is, it's an air pump that attached to some tubing, and the tubing attaches to disposable sleeves. These disposable sleeves, you can be legs, it can be different body parts, but usually legs are the most common. So you're going to apply them, and then when you turn the pump on, it puts air into the sleeves and it causes some compression to happen. This creates pressure around the valves and it increases the venous return. That way the blood is flowing, and it's kind of helping it get back to the top of the body. This is just one device besides stockings that you can use to help prevent DVTs.